Those of us who attended the National HLAA convention last year in Phoenix, Arizona, were privileged to hear Dr. Kathy Pichora-Fuller speak on the emotional side of hearing loss at the highly popular and well-attended research symposium. Dr. Pichora-Fuller is Professor Emerita at the University of Toronto. Adjunct professor is Simon Fraser University. She was a faculty member in the School of Audiology and Speech Sciences at the University of British Columbia. Dr. Kathy Pichora-Fuller's research program concerns auditory aging, and her clinical research concerns audiological rehabilitation for older adults. She has earned an international reputation for her interdisciplinary approach to linking research on auditory and cognitive processing during communication in everyday life. If you Google her biography, you wouldn't believe it. It reads like who's who in the world of hearing loss. Dr. Pichora-Fuller joins us today on Zoom from Vancouver, British Columbia. And it is an honor and a joy to welcome you, Dr. Pichora-Fuller. Welcome. We're so glad you're here. And your hair is longer than it was when you were in Arizona.
Oh, I think I just usually tie it back.
There you go. Welcome. And we look forward to hearing what you have to say, Dr. Fuller.
Okay, so you can see my screen and you can hear me. Is that good?
We can hear you fine.
Okay, all right. Well, I trust you will let me know if we need to make any changes. So thank you so much for the introduction. And the HLAA meeting that I attended in Phoenix in 2024 was actually the first time I had been to the meeting. I've heard about it for years, but it was the first time. And I agree that it is a fabulous meeting. And it was one of the most interesting meetings I've ever been to. So if you haven't been, I would encourage you to take advantage of the information you got earlier. At that meeting, we had a session where there were a variety of different speakers. And in the session, my topic was about the science of emotion and hearing. So I have a bit more time today, so I added a little bit more about cognition, which is another interesting topic that connects to emotion. So I am an audiologist, I'm a psychologist, a cognitive psychologist, and a gerontologist, and now I'm retired. So I'm also an older person myself. And I know you will have members who are not retired, but you know, the aging auditory system begins to have those issues of hearing and noise that were spoken about when people are in middle age. So even 40-year-olds start to have these problems. And some of you may have had your hearing problems start then. Some of you may have lived with hearing problems for a longer time. But I'm just going to kind of shift in and out of focusing on what changes just as you get older, even if you have good hearing, and then what are kind of the added challenges and ideas for people who are older and who are experiencing some hearing loss. I'm going to talk a little bit. I have some other symbols there for the Canadian Longitudinal Study on Aging and the Canadian Consortium on Neurodegeneration and Aging. So these are big research projects that my colleagues and I continue to work on. All right, so let's carry on. So I have been to Rochester. about 40 years ago. I don't know if anybody was around back then when Don Sims worked on developing some of the first computer training for people with hearing loss. And his colleague, Carol DiFilippo, was also working there. That was a long time ago, but Toronto is pretty much on the other side of the lake. So it was pretty close to where I was living. And more a little bit after that, I met some of the researchers at the University of Rochester, and Laurel Carney, who is a fabulous engineering professor who studies hearing, is still there. And Laurel also studies quite a bit about what changes in the aging auditory system. So right now, as was said in my introduction, I live on the west coast of Canada, and mostly we just have a lot of rain here at this time of the year. But when it's a sunny day, we can see the mountains with the snow. So I'm glad to talk to you. And I just want to, if there's only one thing that sticks in your brain after today, I really like this definition of healthy aging. Okay, so according to the WHO, the World Health Organization, and the UN, we are now in the decade of healthy aging. And healthy aging is about creating the environments and opportunities to enable people to do and be what they value throughout their lives. So I think, this has become my goal, and this is the goal that I would like all audiologists to have. And it's great to adjust those decibels, but wouldn't we all be very happy? Happy. We're going to talk about happy a lot today. If you could do and be what you value. And a lot of that will not happen without emotion. So these are actually the words of an older woman with hearing loss. She was attending a session at the Canadian Heart of Association, and she was listening to my lecture about auditory aging. And she gave me at the end a little note, and she had written these words. And this is my touchstone. So in textbooks, I have continued to say her words. She said, and I think you will relate to this, when you are hard of hearing, you struggle to hear. When you struggle to hear, you get tired. When you get tired, you get frustrated. It starts to get to your emotions. When you get frustrated, you get bored. You kind of tune out. When you get bored, you quit. And she said, but I was feeling great today because I didn't quit. So emotions have a lot to do with, whether you persist or whether you quit. And eventually, if you quit too often, you become socially isolated, and that will also create some emotional results which are not good for your overall health. So I was chuckling when I heard about the cap in your earlier meeting where it said, I didn't hear what you said, so I'm just smiling and nodding and hoping for the best. So it's kind of risky. And sometimes you might need to make sure that you are actually understanding somebody's emotions and that you have the right emotional response. So it's not just about the words, it's about the emotional response. I also wanted to kind of paint this bigger picture of how emotions fit into communication and social relationships, and with sensory abilities and cognitive abilities. So I don't know if you've ever seen this before, but this is a really important report of the World Health Organization about how to integrate healthcare for older people. And what they basically came up with is, older people have a little bit of this and a little bit of that, and a little bit of something else. Your knees aren't quite what they used to be. Maybe you're waiting for your cataract surgery and your vision isn't quite what it used to be. And you've got your hearing loss. And maybe, sometimes you have some depression, and maybe sometimes, you're not remembering. So all these little bits kind of come together. So the idea is care has to be integrated. And the way you think about your own health, you have to think about how all of these pieces fit together. And they identified 6 pieces, and 2 of them are sensory, hearing and vision. And even though, this is a group for people with hearing loss, you all know how important vision is, because you use it for speech reading, because you use a lot of visual cues when you have to get some other information to help you to figure out what it was you're hearing. So we are going to talk about hearing and emotion, but we're also going to connect a little bit to vision and mental health and cognition. Okay, so I hope that makes sense. And in the end, this is an approach that can happen in primary care when you go to see your family physician, but it also happens in the community. So I would say this meeting that you're having right now is on that continuum of helping you to function, to be and do what you value as a community member. So whatever your audiologist or your ENT doctor told you, you can put it into action in your everyday life, but it's going to come along with these other things. All right. So we are also, just to kind of make you think about how hearing kind of fits into this Humpty Dumpty sort of a puzzle. We can focus on hearing, but we really need to think about vision, because you do it together, unless it's dark or unless you're driving and somebody's in the front seat. So you're usually hearing and seeing at the same time. You are often moving. We put you in a chair in a sound booth and test your hearing, but it took me 40 years of being an audiologist before I realized that people hear differently when they're sitting down than when they're standing up. So what your mother might have said to you about, I've got something important to tell you, are you sitting down? You actually can listen better when you're sitting down. And you actually need your brain to make sure that you can stand up and not fall over. So your brain is the machine that puts it all together. And it also puts emotion into this collection of information that is coming in that you have to respond to. So you're in a situation, you want to be talking to somebody, conversing. Maybe you want to cross the road when you're out shopping with your friend, and they're telling you a juicy story that you want to remember so you can go home and tell it to your neighbor. So this is the way that everyday life requires you to put it together. So I'm going to kind of weave together senses, cognition, and emotion, and how that all happens in your everyday life. So we need the brain to put it together for us. This is another graph from that work of the World Health Organization about aging. And what it shows on the red line is that, when you're younger, maybe you're preventing some health conditions from happening, or you're in the early stages. And over time, the red line goes down as you begin to have problems in those different areas. But hopefully, audiologists and other rehab professionals can help you to function better. You can help each other to function better by sharing tips like about those technologies you can use in noise, so that even though things are changing, you can function well. So the blue line is kind of elevated, because you can take some actions to function well by using hearing aids, by using technologies. So technology is a way to help you function better. Environments are a way to help you function better. So quiet places are places you might want to seek out. And the other way you can function better is by having good attitudes and behaviors. So we're going to talk about a little bit of all of these things. How does technology help you with emotion? How do environments help you with emotion? And quite a bit about how attitudes and behaviors can help you be better at listening to emotion. Health is, in this way of thinking about it, it's not about whether you have, declines in your vision or your hearing or your mobility or your cognition even. It's not about that line that drops off as you get older. It's about the line that is how you cope. So health is how you adapt to, respond to, or control challenges and changes. And I would say one of our most important tools for helping us to adapt and respond and control all of these changes that might be occurring as you get older is social interaction and communication. I heard a geriatrician give a talk a few months ago, and he said to him as a geriatrician, communication is a tool of care. So if he can't communicate with his patients, he cannot do his work as a geriatrician. So all of you, communication has a lot of purposes, but it actually is essential to your health, I would say, because it is what enables you to establish and maintain relationships. So communication is really important for healthy aging. Communication is what gets you through some of the changes. You are sharing information there about how to use different technologies. That is fabulous. And that sharing of information is good. That's a transactional purpose of communication. But I think it's also the interactional side that we're going to kind of put the spotlight on today. So when you go and try out the devices, what was it, the third week of the month, you can go and try out devices. I'm pretty sure that a bunch of you will go and you will try out the devices, but I think you're going to be laughing and telling jokes and, being patient and encouraging each other. So to get the most benefit out of what you do in your group, it's really about establishing and maintaining relationships. So the meeting started off asking if there were any new people. Imagine if there were new people, there would be introductions and you'd get to know each other. And so this communication is really important. The biggest reason it's important is to establish and maintain relationships. And that communication is really important for your health. There's lots of other purposes for communication. There's music, like uh, um, a form of art that you might want to listen to. There's worshiping if you go to church and you want to hear the service. So it's not like there aren't other purposes, but maintaining and establishing relationships is number one. Um, that's what the anthropologists and other scientists would tell you. Many people, you want to interact with each other, with your peers, but many people are also concerned about interacting, say, with their grandchildren, because these are new people in your life and they're really hard to understand. And maybe you'll get some insights into why they're so hard to understand as we go. So lots of different relationships that are important to people. So I don't know if you've ever, if this is kind of something you already knew or not, but it really is a bit shocking to look at the literature and realize that social relationships, when people have looked at all of the things that are related to mortality risk, what are the things that can kill you? So, smoking is bad for you. Drinking too much alcohol is bad for you. Being obese is bad for you. But social relationships, if you do not have social relationships, that is bad for your health, right up there, almost as bad as smoking more than 15 cigarettes a day. Okay, so your social relationships are part of your health program. You take your vitamins and you do your exercises and you quit smoking and you try to lose weight, and maintaining your social relationships is really, really important for your health and well-being. This is a study that I did with some of my colleagues using data from the Canadian Longitudinal Study on Aging. And so this is 50,000 people actually in this particular study, 50,000 people between the age of 45 and 85. And we asked them about this is based on self-report, hearing and vision problems. So they could say they have no problems, hearing only, vision only, both hearing and vision. And they did questionnaires about these four social network, social participation, social support, and loneliness. So what are those measures? And the conclusion is that this is something that we need to pay more attention to because people with sensory loss are at risk. So the first thing we measured, the first outcome, was how many people are in your social network. So who do you interact with? And some of you, well, you're all at this meeting, so you could check that list off right now today, that you're going to work with fellow volunteers. So who are your people in your social network? So the more people in your social network, you would score higher. Although quantity isn't necessarily the same as quality, as we will find out. There's also, oops, did I do, yeah, how many people do you know? What do you do with them? Okay, so what do you go to? Now you're at a club activity. It may be a volunteer event. So how many people do you know? What kinds of activities do you do? But really, this is probably one of the most important ones, is who can help you. Another study we did looked at who are the people who are most satisfied with their hearing aids. And actually, this social support measure was the most important. And it's got nothing specifically to do with hearing. It's got to do with things like, do you have somebody who you can talk to? Do you have somebody who gives you love and affection? So this social support, it could be, giving you a ride to the doctor's office. It could be, just listening to you while you're trying to work out how to solve a problem that you may be contending with. Lots of different kinds of social support. But we asked about, how much social support was available to a person. And we also asked about loneliness. So I'm sure many hard of hearing people say, even when they're in a crowd, they feel alone. You go to a big family party and there's lots of people around, but you kind of sit in the background and don't connect because you feel like you're isolated because you can't communicate. So when we look at these four things we measured, the red crosses mean that there were significantly different results for people with hearing loss, vision loss, or both hearing and vision for these different measures. And people who just have hearing loss, people who just have vision loss, people who have both, they had less social support and were more lonely than people who had good sensory abilities. So that is not a happy story. We want to be able to do something about that. Some of you may also have seen headlines about how hearing loss is correlated, not necessarily causing, but is correlated with dementia. And this is a fancy picture from a English medical journal called The Lancet that has made a lot of headlines. And a lot of people don't actually, fully understand what it means, because they say there are a lot of potentially modifiable risk factors for dementia. And hearing loss is actually pretty important, but this is about the population. It's not about an individual. So the reason why hearing loss is such a big factor is because so many people have it. And these numbers that they give to these different factors that could prevent dementia, theoretically, it's just theoretical. Basically, the theory is if you could totally eliminate hearing loss, in the world, in the entire world, if nobody had hearing loss, then 7% of the world population would not be at risk for dementia. So it's not about an individual case. Nonetheless, there is a higher percentage of people with hearing loss who get dementia than people with good hearing. But there's a whole bunch of other factors here. And we won't get into all of them, but the ones that I think are kind of relevant for our topic of emotion is this social isolation. Okay, so if you're socially isolated, it puts you at higher risk of dementia. If you're depressed, it puts you at higher risk. If you have vision loss, it puts you at higher risk. Along with the things that, make more sense probably, like smoking and high blood pressure and obesity. So all the things that are bad for your health in general and for your cognitive health, it's not just hearing loss alone, it's hearing loss along with these social emotional factors. So you might not be able to do anything about your hearing, but maybe you can do something about your emotional health. Just to kind of spin this a little bit to the totally other extreme, I don't know if you've ever heard of this idea of a super ager. So super agers are people who are over 80 years of age. Many of them, could be even over 100 years old. People who actually are performing the same way as typical middle-aged, right? So there are these exceptionally healthy, very highly functioning older adults. So instead of focusing on the negative, let's think, okay, let's be a super ager. What can you do? Well, you have to do the medical stuff, like control your blood sugar and blood pressure and eat your vegetables and go for a walk and do all of those good physical health things. You have to exercise. And actually, these super agers don't do a lot more exercise in terms of time, but they push themselves to their limits of physical ability. So they kind of keep up at their maximum. They prioritize mental health and avoid stress. Okay, so they give themselves time for rest and relaxation. They protect and seek help for their hearing and vision. So these are not the people who are avoiding getting help for their hearing. They prioritize sleep. They engage in a lot of cognitive activities, including learning new skills. You go to your HLAA meeting and you learn a lot of new skills about new hearing technologies, so we could check that box. But the big one here is they talk to their friends a lot. So that's, you've got your hearing problems, but keep talking to your friends. So communication is, it's what people say. How many words do you get correct? But it's also, how do people say it? So you want to engage in communication. You want to have a lot of social connections that are meaningful to you. You use your hearing and your vision together, and you want to get the emotion, not just the words. So you are lip reading. Do you see emotion on the face? I think you do. And people have actually studied emotion on the face. So these Ekman, the scientist who studied emotion, determined that these 6 emotions are the basic emotions. So it's like, red, yellow, blue, and green are basic colors. These are the basic emotions. So we have anger, disgust, fear, happiness, sadness, and surprise. And they have looked at, what does your face do when you're making different emotions? So when you are listening, you can get a lot of information from the face. You can even get information from somebody's body posture. And you use that in combination with your hearing. So vision is important. Those cues that people studied on the face, they've also been studied in the voice. So we know when people are talking, even if they're not really saying a lot, even if it's just like wow or wow, there are different ways of talking using different pitches, higher and lower pitch. Yikes, yikes. Same word, different way of saying it in different pitches gives you a different emotion. The speed that people are talking at gives you a cue to different emotions. So fear is faster, sad is slower. The intensity can give you a cue to emotion. So if somebody's angry, they're probably talking loudly. And if somebody's sad, they're probably talking quietly. So these are different kinds of cues than the cues you use to know if somebody's talking about cat versus dog and you're trying to get the word right. Some of you may have cochlear implants. Many of these cues to emotion are the same cues that you would use to listen to music. So emotion in the voice is sort of similar to music. And if you have a cochlear implant, you probably have a little bit greater difficulty getting these cues than even people with hearing aids do. Some people with hearing loss have told me, I don't really care what my teenager says to me. I just want to know when I see them at breakfast if my teenager is happy or depressed, because I want to know how their day's going to go for them. So you may also be kind of really, maybe really important to you just to know how somebody else is feeling of the people that you know. Sometimes the words and the voice don't match, so it's like, yeah, I'm so happy. Is the person really happy? They say they're happy, but the voice tells you it's not the case. So you have to get the words. Sometimes, if it's really important, you can just say, are you happy today or not? And people may tell you, but getting the voice is kind of a sure way of knowing what they're feeling. In fact, the voice is probably more important than the words. Now, the good news about aging is you probably heard this that, you mellow in your old age. So older people are not easily going into uncontrolled emotions like some teenagers are. Um, Older adults have better emotion regulation, better emotional control. They have a lot of experience handling social situations and they know how to calm. So that is actually something that gets better with aging. And I think people with hearing loss, have to master staying calm and being able to roll with the misunderstandings they may encounter and just be patient in sorting them out rather than having an emotional reaction. You don't want people to get angry with you and you don't want to get angry. You want to decide, is this really important and how am I going to get the information and how am I going to understand how people are feeling? Now, why are there changes with age? There are changes actually in the brain to do with your hormones. Teenagers have wacky hormones, and hormones in older adults change. After menopause or during menopause, women have changes in their hormones that can affect their emotions. But in general, hormones are changing. The frontal cortex, the part of your brain that gives you control over your decisions, it's really evolving fast in teenagers, but it's very mature in older adults. And your perception, your vision and your hearing are changing. So all of these changes in emotion, perception, and production in aging have to do with somewhat with hearing, but not only with hearing. So hearing can create some problems because you can't identify those auditory cues. So now I'm going to show you some scientific results. Don't worry if you don't like graphs, I'll tell you what it means. But this is about older adults who have good hearing. Okay, so they don't have any hearing loss. And what is the difference here? So we have different emotions, and what people have to do is say, was the person who was talking angry, sad? Was it a neutral voice? Was it somebody who was fearful or happy or disgusted or pleasantly surprised? So the thing that is being said, it's like when you go to have your hearing test and the audiologist says, say the word dog, say the word house, say the word Joe. When you go into the sound booth for your hearing test, all of the words are very boring. In your life, nobody talks like that voice that you have to repeat after when you have your hearing test. So we use the same words, but we had an actress who performed them in these different emotions. So overall, this is the first thing, is even the younger adults do not get 100% right. You know, this has always got some potential for error. Older adults, the gray bars, you know, they're getting around 60% right, just identifying emotion in the voice, and they're not doing as well as younger adults. And different emotions, some are easier to identify, some are harder to identify. So it's not quite as simple as you might have thought. This is the same kind of experiment, but this is now with people with hearing loss. And what they're doing is just saying the person who was talking was angry, or they had disgust or fear or happy. What was their emotion? And the light bars are without their hearing aid, and the dark bars are with their hearing aid. So there's a little bit of improvement with a hearing aid, but it's not really significant. So this is kind of the bad news, is that hearing aids really don't help you a lot, and cochlear implants really don't help you a lot. This is something that the hearing aid industry is working on. Remember, the people with good hearing were getting about 60%. So the people with hearing loss, even when they're wearing their hearing aid, are not doing as well. So we have kind of a double whammy here between people being older and people having hearing loss. And your hearing aids are not going to solve this for you. So you have to adjust, you know, how you're watching people, how you're interacting with people, in case you have some doubt about whether you're accurately getting emotion from them. But the plot thickens. So let's hang on here. What about the words that people are saying with emotion? You know, if somebody's really scared or somebody's really happy, does that understand them? And I think, if people are smiling and laughing, it's hard to lip read. Um, but what about emotion? So if you meet somebody in everyday life, it's not like the recordings of speech that the audiologist gets you in the sound booth. You know, people actually have emotion. And if they're speaking with emotion, instead of asking them to recognize emotion, now we're asking them to recognize words. And interestingly, if they get a list of words that is all happy, or all sad, or all fear, you do much better, these gray lines, than if they're all mixed up. So if everything is, now it's happy, now it's sad, now it's fear, if it's jumping around, it's really hard to recognize the words. In everyday life, when you meet your teenage family member at breakfast, they're probably not going to change their mood between every bite of their cereal. They're going to either be happy, or they're going to be sad, or they're going to have an emotion that stays for a while. So if you can lock into their emotion, then you can adjust your listening accordingly. So the fact that the gray line is better means that, once okay, I'm listening to happy, then you can listen to the words. You can put more attention on the words and understand. So we have the same basic pattern as we had before, but the difference between the young and the old is less when everybody can lock in on the emotion. There's more difference between the young and the old when it's a rapidly changing emotion. So thankfully, in ordinary everyday interactions, people don't flip that fast between one emotion and the other. Now, this is another piece of good news here. So this, over the experiment, people keep listening. And if we look at the different points across the horizontal, this is as time goes on. And how many words do people get right when they're spoken with emotion? At the beginning, the younger people do better than the older people, and the younger people get better as time goes on. But so do the older people. So if you hang in there, once you lock onto the emotion and you hang in there, it does get easier. So that, I think, is something that you can think about if you're interacting with people where it's really important to get the emotion so that you know how to respond. This is a little technical. I know some of you have been engineers or have technical backgrounds. So if you don't like graphs, don't look at the graphs, just listen. But to get kind of dig into some of the science that we've been doing on this, remember fear. Fear was the emotion where people understood the most. This is the same in vision. If somebody has a fear face, their face pops out in a crowd. So some people say, well, if somebody's afraid, that's kind of a survival mechanism that you would tune into them and you would pay attention to them. And that's an important face. So in the voice, a fear voice really gets your attention. And it gets your attention because there's a lot of changes in the pitch. And those changes in the pitch, we can artificially flatten them. So if we have the full fluctuation in the pitch, the voice is going woo, 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 or we flatten it, that's what happens as we go across from the left to the right on the page. The percent correct is the vertical, and we have 4 lines here. So we have gray symbols. When the background noise, that is so hard for you, the background noise can just be like air conditioning noise. It can be flat, steady state noise. That is not as hard as when you have to hear when the background noise is some other people talking. So when you have to one person and ignore another person, that's the hardest noise to deal with. So TT is when there's 2 talkers in the background. Those are the white symbols. And the squares and the circles, the shapes, depend on if it's young or old. So basically the story here is if we take somebody who said words with fear and we flatten the pitch, we have a slow decline, and it's pretty much the same for younger and older. And the old people can still understand the words pretty well. If we flatten the pitch, they can still recognize that emotion and do well, but not when there's 2 talkers. So older people are not doing as well when it's a talker in the background compared to if it's like air conditioning noise in the background. And partly it's because the way we pull apart one voice from another is using pitch cues. So if you have trouble, if your hearing aid your hearing aid is getting you sounds louder, but it's not helping you to get the pitch cues better. And if you need pitch cues to separate talkers, it's the hearing aids aren't going to do anything for you. And if you're older, pitch cues are something you start to have trouble with, as well as not being able to hear some sounds because they're too quiet. Now, the good news is there's a whole bunch of lines at the top, and then over at the right-hand side, that is where we have neutral. So neutral is flat to begin with. Neutral is a lower pitch to begin with. Lower pitches are easier for you to hear. So an older listener is still going to do better when somebody's talking in fear than when they're talking in neutral. So even though emotions can affect how you actually understand speech, having some emotion in the talker's speech is going to still make it more interesting for you and easier to attend to than if it's just a robot speaking to you in a neutral voice. So robots bad, humans good. If we put on a hearing aid, okay, so these are people who have hearing loss, who are using hearing aids or not. The hearing aid is fabulous. It makes a huge difference to how well you understand words, even if they're spoken in emotion. So, hearing aids are good for understanding words. They're not so great for understanding emotion. So what are you going to do? You want to have people speak to you with clear speech. I'm sure that's a topic you've been through before, that it's better if people don't shout. It's better if people have a slower rather than faster speech rate, and it's better if they have a lower pitch. So those things that you already know about how to tell people to speak clearer, you have to kind of counteract some of the elder speech talk that people may tend to do, because that isn't going to give you clear speech. So clear speech is still going to be good for you. The other thing that you can think about in terms of your emotions as a listener is that it is natural for older people to spend more time on higher quality relationships with fewer people rather than running out and trying to meet a whole lot of new people. So this kind of, how do you form those relationships? Teenagers are out trying to meet new people, and they're in situations where they're learning a lot of new information. Whereas in older people, or people who are younger but have a terminal diagnosis, they tend to put more emphasis on maintaining close relationships that are long-standing. So that kind of makes sense. So if you already know the people in your family and you already know your close friends, you're going to be able to read their emotions better. And the other kind of interesting thing, this researcher, Laura Carstensen from Stanford, she studied this for a long time, emotions in older people and how it helps them to stay healthier and to maintain their brain health as well as other aspects of their health. And she is, now she's from California, maybe that makes a difference, I don't know, but she is a person who has researched a lot about how older people actually pay attention to happy things and they kind of ignore sad things. So she says that older people, part of what happens when they regulate their emotions is that they pay attention to good things and they don't pay attention to sad things. They remember good things, they don't remember sad things. And that is quite different from, say, what a first-year university student would do in the lab. The older people have, just like you have a special attention if somebody has a fear voice, older people kind of tune out things that are negative and they emphasize things that are positive. So this is called the positivity effect in aging. So I don't know if you're really positive, but that is something you can actually work on and you can change. Your attitudes, if you have positive attitudes, can actually really help you out with this. Another very well-known psychologist who's written this fairly recently this quite popular book called Breaking the Aging Code. She has studied so many things, including hearing loss, including dementia, and says that people who have a positive attitude have their hearing loss doesn't progress as fast, their dementia does not progress as fast, and people actually live longer. So there is something to this, positive attitude, and that is part of what I think is common also to these super agers. So, so emotion is part of listening, it's part of communication, it's part of social interaction, it's part of aging well and staying healthy. And there are changes in age for vision, how you recognize facial emotion, as well as voice emotion. But that's going to happen whether you have a hearing loss or not. If you have a hearing loss, you're going to miss some cues. Hearing aids aren't going to help you. But, you can work on that in making sure that you do pay attention to how the people that you're interacting with are feeling. Let them know how you're feeling. And hearing aids are great to help you understand words, but you may need some other conversational skills to help you increase your accuracy with emotion. And stay positive and focus on your high quality social support relationships, and giving social support is also something you can do. So I am going to stop there, and I think we have about 10 minutes or so for questions.
That was so interesting. And the importance of all of us being together, the socializing. So it looks like our chapter is really offering that opportunity, aren't we? Um, who has some questions? Anybody have any questions that they would like to ask Dr. Pichora-Fuller? I think we're also full of wonderful information and the importance of being positive. Yes, we have a question here.
With the studies you've done on how people age and how they respond, are there any cultural differences, societies that are vastly different in their customs, how they treat the age, how people deal with aging? And is there any difference that you find?
That is a topic that has been studied. And, kind of the classic idea is that, say, Eastern cultures, um, have give a lot of value to wisdom in their elders, um, compared to North American society. So I think, um, also interesting. I don't know how things are in the U.S., but in Canadian society, there's been a lot of effort in the last few years on raising awareness about Indigenous culture. And I think that kind of respect for older people and the seniority of older people in Indigenous cultures is something that we can see now, in our cities, people who are kind of tuning into that a bit more. But I think in some ways, if I think about typical North American culture, I think maybe there might be differences between cultures. You have large families, you continue to have multi-generational households, and that is a very different situation than people who live alone. But I think it's there are interesting changes that have happened over the last century, you know, just because families are smaller. You know, so I had 5 siblings, and you know, we knew our grandparents, and there were intergenerational families, and there were lots of um, connections. So how the older person is integrated in the family is kind of a special subset of relationships. Whereas these days, you know, if I think about my son's generation, you know, he has one child. Many of his peers don't get married, people don't have children, and their social network, their family social network, historically, our society, you know, white Anglo North American culture is becoming more isolating, and people are on their phones. And some students, you know, I haven't taught for a few years now. I retired during COVID, but you know, there were students who really didn't have the skills to get up and say something in class. They were terrified because they had come to do everything by texting. So I think, you know, our ability to communicate using speech has kind of changed because of technology and because of changes in family structure. And um, I think it's interesting to think about, you know, what is the world going to look like 30 years in the future, because there's going to be a high percentage of older people, and the younger people aren't necessarily going to have learned how to communicate with themselves, let alone with older people. So interesting question. But these are learnable things. You know, you cannot change your ears. You can change your technology. You can change your environment. You can change your attitudes and behaviors. So I think that's part of adjusting to hearing loss is kind of figuring out, you know, what is your situation and what is the situation of the people around you, and how do you make it work for them, for you and for them.
I have a question.
Yeah,
Go ahead.
Hello?
this is
Yes, what is your
somebody
question?
online.
My question is there any studies regarding introverts and extroverts as elders that in terms of their social, losing social, one more than the other, because of that tendency that they have of introvert and extrovert?
Well, that is another good question. So just to go back to that definition of,
No, Bruce is saying we have 2 minutes before we lose our captioner. So
okay, so
quick
my
answer,
quick answer is, you have, what we want is for people to do and be what they value. So if you have lived your life, you know, as an introvert, you probably need to have a small number of good relationships. That's more important than a large number of superficial relationships. And if that, and if it's the way you always were, and that's the way you want to keep running your life, then just do it.
I have one child that's an extrovert like me, and I have one that's an introvert. So I don't, you know, I know more about introverts now than I ever did in my earlier life. And, you know, it's a concern in terms of later in life for her. So thank you.
Well, I think quality relationships always beats quantity of
Well,
relationships.
that's true. Yeah.
Having 1,000 people on Facebook is not
Well, I
as
don't
good as
have
having one good friend.
as an extrovert, I don't have 1,000, but yeah, anyway, that's, you know, I know that ties in because the social piece is so important. The only good thing is she has very good hearing, much better than her brother. So that's a positive. Thank
okay.
you.
We thank you. That was a great question. Bruce is saying we have 1 minute. Time is up.